Hello, I'm Emma Hammett from First Aid for Life, onlinefirstaid.com and First Aid for Pets. And today I'm going to talk to you about ticks and Lyme disease. Now, Lyme disease is really horrible. It has very serious long-term side effects and it can make you incredibly ill. And you may not know that that is what you're suffering from. Typically in humans, it's misdiagnosed as ME or some sort of chronic fatigue syndrome, and that sort of thing is often the way that it's picked up. But it can make you incredibly ill. It can cause meningitis, arthritis, paralysis. So you need to know the signs and symptoms. You are particularly prone to this if you are a regular dog walker or enjoy rambling round in sort of local meadows and woodlands with just rambling around. What tends to happen is they're extremely common, the little ticks that carry the Lyme disease, in places where there are deer and other wildlife. Now, the ticks themselves, they can carry Lyme disease. Not all ticks carry Lyme disease, but actually there's quite a few ticks that do. And the key is to spot if you've been bitten by a tick and to know how to look out for them. So humans have very serious effects from Lyme disease. Dogs and cats can also get Lyme disease, and I'll go on later as to how they can be affected. So Lyme disease, it can be debilitating, life-changing, and in rare cases it can prove fatal, usually if it's turned into meningitis and then the meningitis proves fatal. So ticks are spider-like small parasites that bite into the skin and they suck blood from other animals, including us. And initially they are minuscule. But they swell as they eat and they eventually become sort of pea-sized and then they drop off when they're full. They're active throughout the year, but they're most likely spotted sort of between spring and autumn. So summer is a key time to be aware. And what you need to be in the habit of is checking yourself and checking your pets when they come in. So you need to give yourself a really good check if you've been walking in any woodlands and ensure that none of these little pests have got onto your clothes or got onto your skin. And if they have, you need to brush them off and get rid of them very quickly. If they are actually biting you, we'll get on to how to remove them in a minute. So they are particularly in long grass. And as I said previously, they love deer. They don't fly or jump like fleas. What they do is they climb or drop on you or onto your pet coat as you brush past. And then they're there ready to bite for you, so they can crawl once they're on. To remove the ticks, if they are actually eating you, it's really important that you don't just get a pair of tweezers and try and pull it out, because what tends to happen if you do that is their mouth parts become stuck, and if the mouth parts remain in you or your pet, then they can quickly become infected. So it's really important to know how to twist out the entire tick. Now, if you know what you're doing, you can do that with a pair of tweezers. Otherwise, a tick removal tool is a really useful gadget because what it does is you get underneath the tick with it and then you twist the entire tick using the gadget. They're very cheap and easy to buy. You can probably pick one up at your vet, otherwise you can just buy them online. But it's being able to twist the entire tick off you that is a invaluable thing to be able to do. You might be sensible as well to retain the tick, so put it in a pot, and when you go to the vet next, or if you go to your GP, they can just double check that it's all come out in its entirety and you haven't left anything behind. So Lyme disease in humans is incredibly serious. You may not know that you've contracted it. You may not register that you have been bitten. Often it starts with sort of flu-like symptoms, lethargy, aches and pains. For about 50% of people, they will develop a classic bullseye type rash. Now I've got pictures of that on both First Aid for Pets and First Aid for Life website, so you can have a look and see exactly what you're looking for. Now that bullseye might not be at the original site of the bite. It can occur somewhere else. It doesn't actually matter where the bite happened. The issue is that it's then affecting your entire system. It can cause really severe long-term problems, as I said before. You can make a full recovery. However, if you are treated quickly and you're given prompt antibiotics that will treat it. However, if it's been in your system for a little while, it can cause extremely serious long-term problems. And one of my friends has got Lyme disease and they feel rotten and have huge amounts of medication to stave away its effects. So humans, it's really nasty. Dogs, only about 5 to 10% of dogs actually develop symptoms of Lyme disease. They don't have bullseye type rash. They don't have any form of sort of classic symptoms. And so as a result, you might not know that your pet is affected until they attend the vet for some other reason. If they do have symptoms, it tends to be things like loss of appetite, fever, lameness, just appearing a bit sad and run down. Swollen and painful joints and swollen lymph nodes are all real classic symptoms that there could be Lyme disease underlying whatever's going on. So key to preventing Lyme disease is to cover up. So cover up with long trousers and socks when you're walking in woodland, and always check yourself and your pets when they come in. I mentioned Lyme disease in dogs. Cats can also get it, but it's much rarer, and they would have very similar symptoms to dogs if they did get it. You can also get tick treatment, which can stop the ticks actually biting your pet. And there's various insect repellents as well that will claim to make it less likely that you will get bitten by ticks as well. And they either kill the tick or they repel the tick. And they can come in sort of tablet forms or spot-on treatments. But the key is prevent yourself being bitten in the first place. Look out for any signs and symptoms, and look out for that tick as well, and be ready to remove it quickly. So check and be vigilant about removing ticks. If you start to feel unwell, go to your doctor quickly, or take your pet to the vet quickly if it's them that appears to be feeling unwell, and ask, could it be Lyme disease? And they will test for it and can start antibiotics quickly. I hope that's useful. That's Emma Hammett from First Aid for Life and First Aid for Pets.